Dr. Kobe. Here at Kids Place Dentistry, we like to see kids when they're around 1 year of age or 6 months after they get their first tooth. Obviously at this point the child does not have a lot of teeth, but some of the reasons why we like to see them at that age is that, one, we like to educate parents on proper ways to take care of their teeth, so hopefully we can keep them cavity free. Two, we like the kid to get used to coming to the dental office so that they can see that it's not a scary place to be. Another reason is we like to obviously check for cavities and make sure there's nothing going on. Hopefully at 1 year that's not the case, but every once in a while there are some cavities that we do find and need to take care of. And then lastly, when they come in, we like to place fluoride on the teeth that helps strengthen the teeth and make them less prone to getting cavities in the future. With all of my patients that come here, I always go through some different education, like I said, to help them better care for their child's teeth. Most people know that they need to be brushing their child's teeth every morning and night, and then also flossing needs to happen once a day as well. A lot of parents wonder when flossing should begin with their children, since most kids do not have contact when they first get their teeth in. But flossing should begin once the teeth are touching. As long as there's no contact, then we can do with just brushing, but once those teeth start touching, that's the time when flossing needs to start occurring. Also, another thing that I go over with parents is that there have been new recommendations that, as far as toothpaste and what they should use for the kids, new recommendation is that we use fluoride toothpaste with all children. The difference is the amount that we use. A lot of people feel that the pea size is always the correct amount, but with little tiny children, you want to use an amount smaller than a grain of rice so that they're not swallowing it and having harmful effects from the fluoride. However, the fluoride will still work to help strengthen their teeth and cut down on cavities. Another thing I like to go over with my patients is that different eating habits that can help create a healthier mouth. Kids that are snacking a lot throughout the day tend to have a lot more cavities, and most people think that candy is the main culprit in cavity causers with kids. But candy is not as big of a problem as some other things are, as far as snacking on carbohydrates, so your breads, your crackers, those goldfish that lots of kids like to eat and snack on all day. Those are big cavity causers. They tend to stick on the teeth for a long time, and they break down into the simple sugars just like your candy does. So those are big cavity causers as well. And then milk and juice in between meals, those are also big cavity causers. Obviously milk is good for you, but it's important to keep it more limited to meal times. If you're at home and if you notice while brushing your child's teeth that there are any kind of staining or discoloration or anything like that, you'd want to go ahead and get your kid in just so we can take a look at their teeth, make sure that it isn't anything serious that needs to be treated, and if it is, then we can take care of it while it's smaller instead of waiting for it to become bigger and possibly a painful issue for your child. Otherwise though, as long as everything's looking good, we'd like to see your child every 6 months so that we can do these things that we've talked about, make sure everything's good and healthy, and keep their mouth cavity free.